It's been weeks since we had to do the unthinkable. Today's news is good news. Our efforts are paying off. We have a long way to go. We have a long road to recovery. We cannot let our guard down now. We must watch the trends like a hawk. The risk of flare-ups is real.
Hi there and welcome to Power in Politics. I'm Vashi Capellos. Canada's largest province is the latest to ease restrictions on how people live, work and play. Today, Premier Doug Ford, as you heard there, announced that Stage 1 of Ontario's three-stage economic reopening will kick off Tuesday, May 19th. Here's what will be allowed to reopen. Retail stores with a separate street front entrance, so nothing inside shopping malls. Auto dealerships are also opening. Construction will be allowed to resume, along with scheduled surgeries that had been put on hold. And outdoor recreational activities like water sports, tennis, or track can also start up. Ford is allowing golf courses and marinas to reopen earlier this Saturday, in fact, since it's the long weekend. Of course, this is all while adhering to conditions like physical distancing. Today, Ontario reported its lowest number of COVID-19 cases since late March, 258 cases of the virus in the last 24 hours. But the province isn't consistently meeting its daily testing target. To address that, the government has changed the guidelines to allow anyone with symptoms to be tested, something Alberta did a month ago. So what took Ontario so long, and how will the province monitor the success or failure of Phase 1? Rod Phillips is Ontario's finance minister. Hi, Minister Phillips. Good to see you again.
Ashley, good to be back.
I have a couple of questions about the plan that your government announced today, the sort of rollout of the way in which the economy will reopen. The first is, why can people have housekeepers or cleaners in their home under this plan, but not people in their family they don't live with?
Well, when we laid out our framework, and I guess it was almost 3 weeks ago, we said that we will be proceeding with advice from their chief medical officer. In the case of what you've talked about cleaners, work around the home, painting, those are areas where when we talked with the medical professionals, when we talked to the chief medical officer, those were areas that they thought they could expand in. When it comes to the numbers of people that can gather together, the chief medical officer said today that he and his team are working with our health table. They're looking at the current data, and they may have an announcement on that sometime next week. But we've been rolling out this in a very systematic way, and we wanted to make sure that we laid out a framework for how we would reopen the economy. And we're very hopeful that starting on Tuesday, we'll see that first stage. And that's just a beginning. It's a gradual beginning, but it's an important start.
I take your point, and by no means am I a doctor. I guess just sort of common sense, my own gut feeling when I heard that was, how I still don't really get what is the medical evidence that it's okay to have a painter in your home, but not your sister who lives in a different house?
Well, of course, what we are expecting everybody to do in any workplace, because you could make the same argument for someone going into a grocery store, Vashi. So what we're saying is they still need to maintain an appropriate physical distance, that 2-meter distance. We need to make sure that we're watching all the hygiene rules that have been set by our health professionals, and that as long as we keep doing that, today in Ontario we had the lowest case count really since well into April. So that's a good sign that things are working, but we're not taking it for granted. We're going to keep taking the medical and science advice, and I think the good news today is we're going to start to see some parts of the economy opening up starting on Tuesday.
And I do want to ask you about that in a second. I just want to be clear then, when the Premier had his 2 daughters over the weekend, is that not the advice that we're not supposed to be doing that?
Well, the Premier commented on that, and I'll let his comments stand. But I think what we all need to do is again, trust each other to do the right thing. That's really the experience we've been seeing in Ontario. I think mostly across the country, whereby people following the direction that we've been given, understanding that we'd all like to see our family, we'd all like to get together with friends. This is a sacrifice. I like to point out it's nothing close to the sacrifice that our frontline healthcare workers are making, and I think that's one of the reasons why people have been so good about doing the right thing.
The Premier stated today explicitly in unveiling this plan that Ontario does have the testing and contact tracing ability to ensure this reopening is safe. But how can he say that when your government has never hit its 20,000 tests per day mark? In fact, even though the province hit more than 19,000 tests over the weekend, it dropped again to under 12,000 on Monday. Are you really testing at the level that can provide assurances to Ontarians that this is safe?
Well, we now have the highest per capita testing, not just in Canada, but across much of North America. And that's the result, has grown over time. The Premier was clear several weeks ago that he wasn't happy with what the testing that was been done. By the end of this week, early in the weekend, we'll have tested all the long-term care facilities, both the staff and the residents there, which is very important. But these were the criteria that we set out 3 weeks ago, again, in support, with support from our public health professionals and our science professionals, saying we needed to have testing at the right level. We need to have contact tracing at the right level. And so it's been in consultation with those same health professionals that we believe, again, if we stay on track between now and Tuesday, that we will be able to start that reopening. And then, as you know, the testing, the contact tracing, frankly, the space in our hospitals, we've made sure that that's available because there are inevitably going to be flare-ups, and we need to make sure that they can be identified, tracked, and then handled through the medical system.
Some days the testing done in Ontario is very high per capita, as you assert, but some days it's not. There hasn't been a consistent week, for example, where every day 20,000 tests are being conducted. In fact, your province just today, your government today, announced that you've expanded the criteria to anyone who is symptomatic. That's a month after Alberta did it. Again, on behalf of Ontarians who are worried about being aware of the true spread of the virus in Ontario throughout society, are you doing enough testing? Are you sure that you can be as explicit as the Premier was today?
Yeah, well, the Premier was explicit that we're going to keep following the health advice that we get, which means that if there is a spike and if we have those concerns, then we will obviously look at how we proceed. But let's be clear on the testing. Ontario has the highest per capita testing in the country. There is, you're right, week over week, during the week variations. In fact, one of the issues that we've been addressing, other provinces did as well, are weekends and the couriers to get the test there. These are all systems that are being improved, day over day, week over week. But that testing and the expansion of the testing, quite frankly, and the Chief Medical Officer said it today, is a move now because of the confidence level to move into population level testing. So that essentially it won't just be up to the clinician at the assessment center. Anybody who has those symptoms will get tested. So again, we see that as a good sign. The health professionals see that as a good sign, and that's why we're comfortable moving forward, subject to maintaining, that we have the tracking, we continue to have the testing, and we continue to have the capacity in our hospitals.
But again, why wouldn't your government have announced that expansion of testing criteria earlier so you could have a more accurate sense of the spread of the virus at the population level prior to opening so much of the economy as will happen next week?
Yeah, well, Vashi, as we pointed out today, we had a focus on our long-term care homes and on our retirement homes. So the Premier mandated and spoke to the Chief Medical Officer about making sure that the testing happened in those retirement homes and the long-term care homes, I correct myself, and that was very important to see that got done. But again, that's why we laid out a framework 3 weeks ago. There were people saying, wait a minute, where's your dates? We wanted to take this carefully and gradually. So 3 weeks ago, we laid out exactly the framework that we're following today. It's exactly the framework that we'll be following 3 weeks from now and 3 weeks from then, because we think people need to know what we're using as measures. And that includes testing that we've talked about. That includes the contact tracing. It also includes making sure there's hospital capacity.
I want to turn to another aspect of the economy while we have you with us, Minister Phillips, and it's the subject I probably get the most mail about, and that is commercial rent. Why has your government not issued a moratorium on commercial evictions?
Well, Vashi, as you know, we are waiting, and I believe it may now be next week that the federal government is going to launch the commercial rent program that all of the provinces have partnered with. That will be over $1 billion of support in the province of Ontario and much more across the country, about $250 million of that coming from the provincial government. And that program has built into it a requirement that there be no evictions or rent increases. So obviously we are anxious to see the federal government get that program launched. And once that program is launched, we're going to assess the progress it makes. But it's a program that, just to repeat for your viewers, means that tenants would be paying 25% of the rent for a period of 3 months, that landlords would be getting 75% of the rent, and that governments would be picking up the other 50%. So once that program is launched, we can judge its viability. I have to say, many of the federal government programs, initially, there's been concerns, whether it was the loans program or the payroll program. We now see hundreds of thousands of businesses taking advantage of them. So, I like everybody else, and I know all of my other fellow finance ministers would like to see the program launched, and I understand that's going to be next week.
That program is predicated on landlords accepting the terms of it, which do, as you laid out, do involve taking a cut in rent. The program, as you said, will also not be revealed in detail, and so until next week. So many landlords don't even know if they qualify to participate, if they're willing to participate. As a result, if you haven't paid your rent in May in Ontario, you can be evicted. Your commercial rent in May, you can be evicted this weekend. Why has your government not acted sooner, even if the federal government is laying all this out, to ensure that, small businesses are not kicked out of the buildings that they rent?
So, Vashi, as you point out, without having the landlords being able to see the program, we can't judge its viability. So, we are both with roundtables that I do quite frequently, a couple of times a week with various chambers, dealing with the CFIB, Dan Kelly, talking to Rocco Rossi from the Ontario Chamber of Commerce. We're in regular contact with the business community, both individual tenants as well as with their
respectfully,
advocates.
sorry to interrupt, Minister, but respectfully, both of those people you mentioned, but both of those people you mentioned have asked you for a moratorium. I apologize, but people are so worried.
Yes, Vashi. So of course are all of us about the economy. We're going through an economic downturn, which is the most significant in our lifetime. So of course there's a great deal of concern. That's why the federal government and the provincial government have over $1 billion that we put together towards this program, and which it'll roll out next week. And I think we will need to see. And at that stage, we'll judge whatever other steps that might need to be taken once we see the actual uptake. But I remind you that you and others were critical of some of the other programs that the federal government and the provincial governments have put out. But in time, understanding that we're all doing our best as we go through this to try to make sure we adapt to the worst financial circumstance in our lifetime, by a global health crisis, that we're trying to make sure that we put programs in place that are sustainable and that will work.
I understand that, Minister. I'm not trying to take away from your intent at all. I know that both on the part of the federal government and your government, the intent is certainly not to do harm. I'm simply saying that time has run out for so many of these businesses, and that's the message that they've delivered to me unequivocally. And that's why I'm asking you why you haven't acted sooner.
Yes, and you have my answer.
Thank you, Minister. I appreciate your time this evening.
Thank you, Vashi.
What will all of this mean for the province's economic recovery? Sean Speer was a senior economic advisor to former Prime Minister Stephen Harper, now an assistant professor at the University of Toronto. And Dwight Duncan is a former Ontario finance minister, now principal and director at Macmillan Vantage. Hi, Mr. Speer. Hi, Mr. Duncan. Great to see you both. Thanks for making time for us.
Thanks for having me.
Thanks for having us.
Before we get into what recovery might look like or what we should be thinking about, I wanted to get sort of your perspective from both of you, or the perspective from both of you on how great the magnitude of this crisis is economically. Mr. Duncan, I'll start with you.
Well, this is certainly the largest economic impact event in our lifetimes. Arguably, it could turn out to be worse than the Great Depression was. It's going to take, in my view, some time to get through everything. I was Ontario's finance minister at the time of the last Great Recession, and frankly, the magnitude of this is so much greater that I don't envy our leaders who have to deal with this. And some very difficult choices ahead, both public health choices as well as economic choices.
Mr. Speer, I know you were also working in government on the federal side of things during the last economic crisis. How does this compare, do you think?
Well, let me just echo what Mr. Duncan said. To put it in some perspective for viewers, Vashi, in 2009-10, at the peak of the Great Recession, the federal government's deficit was about 3.5% of GDP. This year, we're anticipating that the federal deficit will exceed 12% of GDP, and the federal and provincial deficits in total are likely to exceed 20% of GDP. So magnitudes higher than this last experience. And in a sense, policymakers across the country, across the political spectrum, are dealing with a set of issues without a playbook. And so as Mr. Ford in Ontario and premiers across the country start to transition from the immediate priority of public health to beginning to reopen the economy, they are going to be operating in the dark in a way. And I think we're inevitably going to see an exercise of trial and error as we try to get the balance right between advancing our public health priorities and beginning to reopen our economies.
That's a really interesting point, Mr. Duncan, and I'd love to get your thoughts on that as well, because we have seen, and every day I'm listening to, each premier all the time talk about this phased out approach, and there are differences depending on the province you live in, depending on the city you live in, actually, in some provinces. How difficult is it, or will it be, to navigate this almost interim period, as Mr. Speer puts it, between everything being shut down and then things eventually, goodness knows when, getting back to normal?
Well, that's going to be a very difficult situation to manage. I'd start by saying that today's announcement in Ontario is a good example. I think the Premier and his government are getting it right at this stage. They're taking this three-phased approach now that they're into the second part of the timeline around COVID. We'll have to wait and see how things open up starting Saturday with golf courses and some of the other facilities. But they're also going to have to bear in mind that they're going to have to be flexible should there be a spike in cases. As well, we have to keep the emphasis on testing. We've had lots of problems getting testing done. They're not political problems. These are all problems in my view, with accessing supplies and so on. So I think the steps the Canadian provinces are taking are the right steps. I think Ontario's announcement today is a step in the positive direction, but they're going to need to be prepared to step it back should they see a spike in the number of cases in the coming days and weeks.
Mr. Speer, go ahead. First, I was just going to ask.
I would just add, Vashy, that it's striking when you think about it, that we're really learning in real time. It was only about a month ago when economists and other observers were talking about a V-shaped recovery. And instead, we're now reconciling ourselves with the fact that we're inevitably going to have this staged or sequence approach. Just think about it. Today, Premier Ford's announcement involves 95 separate guidelines to inform businesses and Ontarians rather about this transition period. And so the idea that we'll have a fully functioning, fully operating economy in the near term is just today's announcement reinforces that this is going to be a gradual, incremental process. And as Mr. Duncan says, it's necessarily going to involve periods of adjustment as we learn more about the state of our economy and, of course, the state of the health of Ontarians.
Let me quickly follow up with you, Mr. Speer, because I'm wondering what your thoughts are, recognizing, obviously, that we're in the middle of sort of the acute part of this. But in the long term, what you just laid out, what does that mean for recovery?
Well, it makes it so challenging to plan. When Mr. Duncan was Finance Minister in Ontario and Mr. Harper in Ottawa were dealing with the last financial crisis, the transition from the depths of the crisis to a fully functioning economy was relatively straightforward. This time around, thinking through when to begin focusing on deficit reduction, for instance, is difficult, will be necessarily difficult for policymakers to plan around. And I think it's a wise move on the part of the Ontario government to establish a cabinet committee that's focused not just on the short-term transition period that we're describing now, but long-term planning. When we can get into it, when we're in a position to be able to inject economic stimulus in the economy to get economic activity and economic growth roaring again. Economic growth will be fundamental, not just for creating opportunity and work and investment here in the province, but also with dealing with the deep fiscal challenges that Ontario and other governments across the country will be facing as a result of the extraordinary steps taken to deal with the immediate crisis.
Mr. Duncan, your thoughts on what a long-term recovery might necessitate and might look like?
Well, first of all, it's going to be long-term. I would say that governments are going to have to start at some point looking at recovery, how we move towards recovery. You can rely to a certain extent on growth in the economy at some point, but you're also going to have some very, very difficult choices to make. You're going to have to address problems that were here before coronavirus. We've got two provinces that arguably are in much worse shape than the others. I'm speaking now of Newfoundland, Labrador, and Alberta, essentially the energy producing provinces. So finance ministers, governments are going to have to be very cautious determining what is needed, when it's needed, and there are going to be some very difficult choices. Nobody is, I shouldn't say nobody, they're all trying to avoid some of the tough questions which media analysts are throwing at them, starting to throw at them. You know, will you raise taxes to help pay for this? All those sorts of things. So I would think that it's going to take a good long while. Be interesting to see if we have a budget or not, either in Ontario or in Canada this fall. Governments don't have to deliver budgets. Budgets are a relatively recent phenomenon in our parliamentary history. Kind of where the rubber hits the road is when the governments have to table estimates and when they have to get supply. Those are the sorts of issues that are going to start to take center stage once we have got this thing under control. And frankly, the big challenge is a vaccine and when we'll see one and when it'll be available. And you know, I've heard speculation anywhere from several months to a year and a half. So all of these questions are important. There's no easy way, and there's not going to be any easy way out of this.
Okay, I have to leave it there. I'm out of time, but I want to thank both of you for your time this evening, and hopefully we can check back in throughout this, as we've all said, it will be in the long term. Thank you very much to Sean Speer and Dwight Duncan.
Thank you so much.
Premier Ford said the province has the testing and tracing capacity to move ahead with this plan. But with the province still struggling to meet its daily testing targets, how important is it that that testing ramps up? Dr. Gerald Evans is the chair of the Division of Infectious Diseases at Queen's University. He joins us from Kingston. And Dr. Zane Chagla is the medical director of infection control at St. Joseph's Healthcare in Hamilton. He joins us from Mississauga. Hi to both of you. Thanks so much for making time for us.
Good evening, Vash.
Thanks for having us.
Dr. Evans, I'm going to start with you and I guess ask actually for your initial impression of what the provincial government in Ontario announced today from a public health perspective. Does it make sense to you?
It does to some degree. There's certainly regions in Ontario that are seeing a lot less activity of COVID-19 than the largest metropolitan centre in the way of Toronto. And it is a staged approach, which I think all of us have been really pushing for. So not a sudden, ramping up of social activities without maintaining some social distancing. So it's a reasonable proposal at the moment, just recognizing we're going to have to be very careful and watch how things go with this latest group of changes, which will be enacted next week.
Dr. Chagla, on the subject of testing, this is the part that really jumped out to me because the Premier was very explicit today. We're testing at a level and we have contact tracing at a level that can provide Ontarians with the assurance that this is safe to do. I'm very confused by how much testing is the right amount of testing. I'm obviously not a medical expert. Are we testing enough in Ontario right now from your perspective?
So as of yesterday, I don't think we were testing enough. Remember, we had some stewardship on some of these tests so that we tested people that were symptomatic but were either vulnerable or healthcare workers or people that were hospitalized. The announcement today came with anyone who is symptomatic should be tested. And I think as we reopen and we have to get a sense of what's going on with our communities moving forward, that has to be a defining principle of this, that people need to come forward if they're symptomatic so that we know what's going on in our communities. And as Gerald had said, we can take local action within our communities and really define that regional what's going on.
Dr. Evans, on the subject of the criteria for testing, how broad is the safest possible sort of set of criteria? And by that, I mean, in Alberta, parts of Alberta right now, you don't even have to be symptomatic, actually. You can just get tested if you need to be tested. Do we have to be at that level in order to, I guess, feel confident that the economy can reopen, not just in a phased way, but to a high degree?
Well, I would say with the change in definitions that were brought in, the case definition and the expanding of symptoms on May 12th here in Ontario, we are literally going to be easily testing somewhere around 3/4 of the population, the criteria and symptoms are very broad, include very, very common things that, I think certainly Dr. Jagala and I could easily debate about whether that's a reasonable thing to do. And right now, when people come to primary assessment centers, certainly here where I am in southeastern Ontario, if you walk into a primary assessment center and literally, even if you have no symptoms, they're probably going to test you.
Dr. Chegla, beyond testing, it's also contact tracing that my understanding is really key in order to figure out how to reopen the economy or to the degree to which you can. Can you give us your assessment of contact tracing right now in Ontario, for example, or even what the bar should be right across the country?
So, I mean, this goes back to the testing strategy. So before, where people who had mild disease that didn't really make it to testing or didn't fit the criteria for regional testing, we tell them to go home, isolate, and their contacts to isolate for 14 days. That's not very robust. We don't know those people that you were in contact with at work. You call every single one of them. And so that contact tracing isn't done. So, or at least not done to a point for these mild cases that aren't tested. Now that you introduce testing for mild cases, those cases that then turn positive, public health then reaches out to those patients. They say, who are you in contact with? They isolate the people that you're in contact with. They test the people that are symptomatic you're in contact with. And those chains of transmission start going down when there is chains of transmission in the community. There's a great example in South Korea of this happening, where once they opened things up, they saw a big outbreak. As they started testing people and doing contact tracing, they realized it was secondary to a nightclub. And so they shut down the nightclub. They did enhanced cleaning there, but they were very rapidly able to determine where the source of their outbreak was and take measures not only to protect the people, but to stop the source.
Yeah, the South Korean example, Dr. Evans, is fascinating. They were, from my reading, they were able to contact thousands of people who had been there within 24 hours and then ascertain that I think it was something around 100 of them actually contracted the virus from them. They had them tested and isolated. This is within a 1 to 2 day period. Do we have the capability here to do something like that yet?
I would say we're probably not at the level that South Korea is at. A smaller population, but a very intense public health program for contact tracing and following up. The example that Zane gave you is a really good example of how robust that is. And it really depends in Canada whether you're in a very dense populated area like the metropolitan Toronto area or even Montreal or Vancouver versus a sort of smaller city like I live in which case you may have adequate resources to be able to do that. The speed, however, that it happens in South Korea and their effectiveness at doing contact tracing is really quite outstanding, and it would be great if we could do that here. We need the resources in public health to be able to do that.
Fair point. If I could follow up with you, Dr. Evans, before we go, I'll ask both of you. I think a lot of people are living right across the country right now in the process of watching this phased out approach to reopening the economy and sort of wondering what it means for their own behavior. And by that, I mean, do you still stick at home as much as possible? How often should you venture out? Is there any advice you have to viewers who are watching right now sort of thinking about that?
Well, my thoughts are just really to stick to common sense. You should certainly not be going to areas where there's a lot of aggregation of other individuals. I think the kinds of practices that Canadians have embraced during this social distancing period need to be maintained as much as possible. The opening up of society in general is increasing, but we know that most people have a fair degree of common sense about what they should be doing. And even if you look at examples like Georgia, which was a state that suddenly opened up everything, they may have opened up restaurants, but nobody was going to them. And that suggests that there's a degree of caution, I think, that's important for the public to have.
Dr. Chagla, same question to you. Viewers who are looking for some advice on their own behavior, what would you tell them?
Yeah, I think as Dr. Evans had said, common sense is key. I think that the big thing is people that are sick and have symptoms should not be going out in public. This isn't an excuse for that. I think workplaces that can still establish some work from home or virtual policies are very well able to do that. It clearly has worked for the last 2 months, so they can continue to do that. And really avoiding, again, these openings aren't an excuse for not social distancing, for not washing one's hands, for not respecting those spaces, those boundaries, even in things like lunchrooms and break rooms. And so those things really still need to be enforced in workplaces. And people still need to be vigilant when they go back into society.
Okay, great advice. I really appreciate both of you making the time this evening and appreciate your expertise as well.